Happy New Year. I'm so excited to tell you about, I got asked this question recently, and the question was, what is the point of joining a membership practice? So I'm excited to answer that question tonight. This is Inspire Primary Care. I'm Dr. Jade. I'm coming live from Inspire Primary Care. And I wanted to share with you guys why we do a membership, why join a membership practice, and what's included in the membership, because those are questions I get asked a lot. All right. So if you are joining us, drop in the chat where you're from. I'm coming live from Las Vegas at Inspire Primary Care. So the first question, the first part of the question I want to answer is, do you take insurance in your practice? So what I want to just put out there right now, we are a membership practice at Inspire Primary Care. I will explain what that means in a moment, which means we do not bill insurance in the primary care office, and I will tell you why in a moment. We do a flat monthly or annual membership for unlimited primary care directly with your board certified physician. Now, let me tell you why we do a membership, because I get asked this all the time. Why can't I just use my insurance? There is a completely different experience when your doctor works for the insurance company versus when your doctor works for you. All right, let me explain this. When your doctor works for the insurance company, or when a doctor works in an insurance-based practice, your doctor has to do, for the business to run in an insurance-based practice, your doctor has to follow the rules the insurance company puts out for the whole business to get paid, okay? And the type of rules that insurance companies create all drive their revenue, but they do not drive what creates the better patient care or patient experience. And so what I mean by that is, in an insurance-based practice, insurance companies tell doctors how long they can be in the room with a patient, and doctors can get fired if they spend too much time in the room with a patient. The typical time frame that insurance-based practices give a physician is 10 to 15 minutes max in a room, okay? Which is not enough time to let your patient get all the questions out that they have. It's not enough time to really think through the problem and use your full scope of practice, which leads to physicians being forced to prescribe more pills or to refer out to specialists more often than is actually required. It just requires more time, okay? But in an insurance-based office where the doctor works for the insurance company, the physician has to follow the insurance company's rules, and one of those rules is the doctor gets a max time of 10 to 15 minutes in the room. Very rushed care. Now, another rule that an insurance company puts on the physician is that they have to have a lot of people on their patient panel, meaning the average insurance-based doctor has 3,000 or more patients on their patient panel, meaning for every one doctor, there's 3,000 people all trying to schedule with that doctor, which is why it takes over a month. Actually, in Las Vegas, the average time to get in with an insurance-based doctor, primary care doctor, right now is 2 to 6 months. That is because over 3,000 people are all trying to schedule on that one doctor's schedule, which pushes out how far you can see your doctor, all right? So these are a couple examples of why the healthcare system is so frustrating, because your doctor doesn't work for you, your doctor works for the insurance company, and the rules they create drive the insurance company's revenue, not patient care. Versus in a membership medical practice like Inspire Primary Care, we follow a direct primary care model or a membership model. What does that mean? A lot of people have not heard of membership practices. There are over 2,000 of them throughout the country, but it's a new concept for a lot of people. You can think of it just like a gym membership, a Costco membership, a Netflix membership. It's the same type of membership, monthly or annual, for unlimited primary care directly with your doctor. Now, in this scenario, your doctor works for you. So all of the things I have created in my office all exist around what will give my patients or my members the best quality care and the best primary care experience. You see how the shift shifts from being about money in the insurance-based practice versus being about the patient in a membership practice. And my goal going into medicine was to give my patients the absolute best care, okay? So in a difference you will experience is You get my cell phone number. All my members have my cell phone number. They directly text me when they have questions or concerns, and I respond back to them. Not someone else, not a nurse, not a call line. It's me. All right. And another example is they don't have to wait months to get an appointment. They have their own self-scheduling link where they directly go to my calendar, and they schedule with multiple flexible options, either in person, via video, via phone, so they can do whatever is most efficient and convenient for them. Okay. And then they have access to me Monday through Friday during business hours via text, and 24-hour access to me via email. Again, all of it comes to me and I respond back. So it is care that is focused on quality for my members. For an example, over the holiday weekend, it was Christmas actually, and this patient, most of my members knew to not contact me on a holiday, but this member had, it was a kind of an urgent need, and they text me, and I text them back, and their prescription was at the pharmacy within an hour. Okay. Now, I don't know if the pharmacy was open or not, but I sent the prescription within an hour. That is something that would never happen in an insurance-based practice. I don't know when they would hear back, maybe now, a week later, but it wouldn't be the same day. However, when your doctor works for you, things happen faster. Another example is, the typical wait for specialists in this city in Las Vegas is about 6 months, 4 to 6 months, depending on the specialist. Okay. And so I text my friends, because I have lots of friends that own private practices in different specialties. And I said, hey, this is a cardiologist. I said, hey, I have a patient and I need you to see them. How soon can you see them? And they were like, oh, for you, we can get them in today. That doesn't happen in an insurance-based practice, because I've built personalized relationships where my members get a VIP treatment, even though the membership is very affordable. Now, what's affordable is variable person to person. However, people will think that concierge level care would be much more expensive than it actually is. So it's something I just want you guys to know, that these options exist. Quality primary care options exist, and you do not have to settle for the poor quality of care that exists in an insurance-based office. All right. What all is included in the membership? I get asked this a lot. 90% of healthcare is primary care. So all of the things you would go to an urgent care for, acute needs, are all primary care. Okay. Are all included in the membership. Okay. So anything that is urgent that you would go to an urgent care for are included. Any chronic care, meaning if you are diagnosed with something that needs management, thyroid disease of any sort, hypothyroidism, hyperthyroidism, diabetes, cholesterol, high blood pressure, or hypertension, I manage all of those things. I am a wellness-focused, board-certified family medicine physician with additional training in lifestyle and preventive medicine. I help my patients to prevent and reverse chronic disease. I help them to transition to a healthy weight. But I get asked this question, do you prescribe medication? Yes, I am Western trained. And so, yes, if you need medication, then absolutely I prescribe medication. But my goal is for my patients to be medication free if possible. I am looking forward to meeting with you as well. Hey, Mellow Vegas. Mellow in Vegas. Got you. I'm looking forward to meeting you as well. Okay, so that is a major difference that my members experience. Okay. Let me know what other questions you guys have about Inspire Primary Care. I really want to make the membership model just make sense, because it's so simple that it confuses people. It's like, wait, one flat monthly or annual membership fee directly with your doctor for unlimited primary care. We were going through what all is included in the membership. So we said acute care, chronic care, it all came back to me. So acute care, chronic care, office procedures. This is a huge cost saving. So if you cut yourself open, needs to be sewed up, if you need a joint injection, if you have an abscess that needs to be drained, if you have a skin tag that needs to be removed, we're family medicine physicians are trained in a lot of office procedures, and I include those free for my members for no additional charge, which is amazing. Let's see, I removed the IUD recently for a member. So we do a lot of different procedures, all free, all right, or included in the membership. Let's see, what else is included? I feel like I'm forgetting things. Preventive care, which is my favorite thing, helping to prevent. So all of my members have access to my wellness coaching services. I'm encouraging them all to get on their personalized Inspired Health Method wellness plan. And we meet monthly. My members that are healthier, we meet monthly to go over the wellness goals, create new goals, and continue to get towards a healthier lifestyle. So that's really awesome. Children, pediatric care is included. Just regular routine adult care like acne treatment, just the regular things that come up, randomly. Your knee starts hurting, all of that. 90% of care is primary care. The other 10% is going to be the need to see a specialist, the need to go to have a surgery, or the need to be hospitalized. And that 10% of care is where insurance comes in. All right. And of course, using it at the pharmacy to pay for medications. So I hope that answers what all is included in the membership. It's 90% of healthcare is primary care. And this way, your doctor is just a text message away, which how awesome is that? Okay. So I hope that answers that question. Now, I want to tell you, Inspire Primary Care is now enrolling new members. We will be full once we reach 350 members. I just like to make this clear because I don't want you to wait until there is a waiting list. Once we reach 350 members, our practice will be full. We will have a waiting list to join the practice, and I don't want that to be you if you've been thinking about joining. All right. We do have a weight loss program that does not require for you to be members. It is a phenomenal, powerful program. Our members are losing 20 to 50 pounds on our weight loss program. We have a 3-month and 6-month program. It can be with or without prescription weight loss medication, and the results have been fantastic. You do not have to be a member. We have a separate package for non-members. However, that is included for members as well. So regardless of your goals, if you want a primary care physician who is going to give you excellent 5-star experience primary care, Inspire Primary Care is here for you for that. And if you just want weight loss without the primary care services, we also now offer that. So let me know what questions you have. I am just so excited to serve you guys in the new year. We're excited to continue growing our business and our impact in the community, because we want Inspire Primary Care to not just be a wellness-focused private practice. We want to really get involved in the community in this new year and promoting wellness for not just our members, but for non-members and the community in general as well. Which leads me to my final point. Please join us next Saturday, January 14th, 12 p.m. to 2 p.m. We are doing a Flirty Dance Fitness class, New Year, New You, Dance with the Doc event. Come out and dance with me, you guys. We are making fitness fun, and we're getting together to just be healthy, talk about Inspire Primary Care, but really the focus will be dancing and having a good time, getting healthier in the new year. So come out and join us. It's at Noboa's Dance Studio, 12 p.m. to 2 p.m. next Saturday, January 14th. I can't wait to meet you guys and dance with you guys and to serve you in this new year. We're now enrolling members at inspireprimarycare.com. We spell Inspire without the I in the front. You just click the enroll button at the top. And I don't want to forget to tell you, if you schedule an appointment in the month of January, we do have a few January spots available. If you schedule in the month of January, you guys, the enrollment fee is waived. So we wanted to continue that gift from the December month into January as well. So schedule your onboarding appointment for January. Get that added bonus of the enrollment fee being waived, because February 1st, the enrollment fee will be back. So if you schedule your onboarding appointment in the month of January, no enrollment fee, and I just can't wait to serve you. See you soon. Drop in the comments where you're from and what other questions you have about Inspire Primary Care, and I will answer them soon. Bye.